Imagine a computer that can learn, reason, make decisions much like a human brain. This is the core idea behind artificial intelligence, or AI. Not futuristic robots from movies. It's smart software that analyzes huge amounts of data and finds patterns invisible to the human eye. Think of it as an assistant that has studied millions of medical cases in seconds. This tech uses complex algorithms, think detailed instruction sets, to process data and improve itself through machine learning. That's what makes AI so powerful in data-rich medicine. When we feed an AI thousands of medical images, X-rays, MRI scans, it learns subtle differences, a healthy organ versus one showing disease. It doesn't get tired or distracted, it focuses on data, finding connections and anomalies with precision. Not replacing doctors, giving them a powerful digital partner to sift overwhelming information and find critical patient details. In hospitals and clinics around the world, AI is no longer a distant dream, but a present-day reality, working behind the scenes to streamline operations and improve patient outcomes. One of the most significant applications is in managing the immense flow of patient data. Every visit generates information. Every test generates information. Every prescription generates information. AI systems can organize this electronic health record, flagging potential drug interactions, alerting doctors to a patient's allergy, reminding them of necessary follow-up tests. This automated oversight acts as a crucial safety net, reducing the chance of human error and ensuring that every detail of a patient's history is considered, making the entire process safer and more efficient. Beyond administrative tasks, AI is directly involved in personalizing treatment plans. For complex diseases like cancer, what works for one person may not work for another. AI algorithms can analyze a patient's genetic information, lifestyle factors, and the specific characteristics of their tumor to suggest the most effective therapies. One of the most life-saving applications of AI is in medical imaging. It is helping doctors diagnose diseases earlier and with greater accuracy than ever before. Radiologists spend their careers training their eyes to spot abnormalities, X-rays, CT scans, MRIs. However, even for the most skilled expert, some signs can be incredibly subtle. AI algorithms, trained on millions of scans, can detect these faint patterns with remarkable sensitivity. For example, an AI tool might highlight a tiny group of cells on a mammogram that could be an early-stage breast cancer, a finding that might otherwise be missed until it has grown larger and more difficult to treat. This technology is proving particularly powerful in the fight against cancer. In pathology, AI microscopes can scan tissue samples and identify cancerous cells with a speed and consistency that surpasses human capabilities. For lung cancer, AI programs can analyze CT scans and identify suspicious nodules with incredible precision. A real-world example comes from studies where AI has been shown to detect lung cancer from scans a year or more before typical diagnosis. This head start can be the difference between a treatable condition and a terminal diagnosis, fundamentally changing a patient's prognosis. The relentless pace of technological advancement means the role of AI in healthcare is set to expand in ways we are just beginning to imagine. We are moving beyond simple pattern recognition to predictive analytics that can forecast health problems before they occur. By analyzing a person's complete health record, genetic data, lifestyle, information, sophisticated algorithms can calculate their risk for developing conditions like Alzheimer's, stroke. This foreknowledge gives doctors and patients a precious window of opportunity to make preventative changes. Diet, exercise, proactive medication, potentially stopping a disease before it ever takes root. Another groundbreaking frontier is AI's role in drug discovery and development. Creating a new medication is an incredibly long and expensive process, often taking over a decade and costing billions of dollars. AI is dramatically accelerating this timeline. It can analyze complex biological data to identify promising molecular compounds, bringing new, life-saving treatments to patients faster and at a lower cost than ever before. AI is making medicine smarter and more humane.